Tonight, traces of a deadly bacteria potentially let loose in the halls of the Centers for Disease Control and Prevention. Anthrax is known as a bioterrorism weapon.
And 75 workers might have been exposed and are receiving treatment in order to ward off getting sick. Fox 5's Jacqueline Schultz is live now at the CDC to talk about how this could happen. Jacqueline.
Bottom line, guys, we're told that safety protocol was not followed here. Officials tell us that anthrax spores became airborne in some of the labs here, and that's how possibly so many people were exposed to the anthrax bacteria. Between June 6th and 13th, anthrax spores, as shown in this picture from the CDC, may have gone airborne in 2 labs. Officials say scientists in one lab handled anthrax samples, didn't properly treat them, and transported live anthrax into other labs. In a statement, the CDC tells Fox 5 the potentially infectious samples were moved and used for experimentation. Workers, believing the samples were inactivated, were not wearing adequate personal protective equipment. The CDC says those labs and halls were decontaminated, and 75 workers are being seen by doctors and given medication.
When the patients inhale anthrax, it can be lethal. Usually 75 to 85% of patients will die.
ER-trained Dr. Raul Rodon of North Atlanta Urgent Care says ER doctors can spot the signs of anthrax infection after an exposure.
Fever, fatigue, malaise, weakness.
Dr. Rodon says after time, a victim's body can go into shock. The CDC says workers are being given antibiotics as a precaution. Dr. Rodon says common medications like high doses of penicillin will help patients, although it could take 2 days to 3 weeks for symptoms to appear. The CDC says other staff, family members, and the public are not at risk. But Dr. Rodon tells us it is very easy in a possible exposure for anthrax to travel.
The spores, they can leave. They can be in our clothes. They can be in our body, and they can easily be inhaled by a family member.
The CDC tells us that there is an ongoing investigation right now, and they do promise that those workers who didn't follow protocol will be disciplined. And they also say they're going to review safety procedures with all workers in those labs as to how to handle deadly bacteria such as anthrax. Reporting live outside the CDC tonight, Jacqueline Schultz, Fox 5 News.
Yeah, the potential consequences so frightening. Jacqueline, thanks.